Hello and welcome to the Connect Cape Fear podcast, where locals, newcomers, and travelers in and around Wilmington, North Carolina find community and connection in this beautiful place that we call home. Our guest today is Maxton Sockwell from American Family Care. Maxton, welcome to the podcast.
Hey, thanks for having me.
Absolutely, man. So tell us a little bit about yourself. Who's Maxton Sockwell and how did you get to Wilmington?
So I got into UNC Wilmington about 10 years ago, came here as a student. And while a lot of students end up here, they never want to leave. And I was lucky to find a couple fun jobs and lived on the beach for a few years after graduation. But unfortunately, when COVID hit, I realized that my jobs in the hospitality industry came to a close really easily. And I'm thinking to myself, all right, how am I going to be in a way where I don't have to worry about job security in the future? And definitely enjoyed the fun employment train for a little while, but kept my options open. And reached out to a few different family friends, and one family friend reached out and was like, hey, I'm looking at expanding in New Jersey. I have this wonderful opportunity. I want to open a healthcare office. You should come up and work with us. And I told him, very politely, I was like, I don't want to move to New Jersey. Thank you. I like it here in Wilmington. And I looked more into the model, and I was like, wait, that would actually be an incredible model to open up in Wilmington. And he's like, really? Well, let's look into it more. And so he flew down, visited, and we looked at some different sites, looked at the demographics, and we're like, wait, this would be a perfect location. And so we ended up going with the franchise and got the license and found a great spot right on South College Road and opened our doors in October. And being in Wilmington now, I've lived here for 10 years, but now I've been able to be a part of serving the community for closer to a year now.
Let's start from the beginning and work our way forward then.
Okay.
So what is it about UNCW students, when they get here, they just have absolutely no desire to leave? What's that firsthand perspective that you can speak to on that?
Well, I would say it even starts with the day right before your first day of class with Beach Blast. I mean, getting out there and having the entire campus all on the beach at one time and just seeing like, okay, this is life here.
Mhm.
This is actually real. It's not just a movie or something. Okay, never want to leave. I mean, there's just something about being close to the water, being close in that environment, and just having that accessibility that, I mean, I found a deeper sense of self when I'm closer to the water. And I feel like a lot of students maybe find that sense of self here as well. But honestly, just the people, the environment, the culture, everything around it, it's just this sense of ease that just kind of spreads over the whole town that you especially feel as a student. And you kind of have a new sense of home you don't really want to let go of. So
yeah, I'd say UNCW is probably the number one reason for population growth here. Like, we're going to come here and go to school, and then we're just never going to leave.
Yeah.
Yeah.
Well, I luckily graduated. It took me a little while. But then I thought to myself, okay, everyone that I'm meeting, because being in hospitality, I was working at a resort. Everyone that I met, they were so stoked to be here for just like 2 days or be here for a week. It's like, okay, if you work that hard just to be here for a small amount of time, it sounds like if I just get to live here, every day could feel like a vacation.
Yeah.
So that was one of the reasons as well. It's like, okay, if you can live every day like a vacation, like when are you ever feel like you have to work or anything?
So you're in business ownership now.
Yes.
Does every day still feel like a vacation now that you're a business owner?
You know what? I get to wake up and tell myself to go to work, which is an internal battle with itself. But at the same time, I do appreciate having that work-life balance. At the end of the day, if something needs to get done and it's not being done, I have to do it. And I appreciate that extra level of like difficulty or that extra, how would I say it? I guess I'm asking more of myself now.
Yeah.
And so I would say that vacation, when I do get to that point, it feels even more like a vacation. And then otherwise, I mean, working for yourself at the end of the day, it gives you that work-life freedom that if you can make little moments happen, there's one less person telling you no. So.
Right. Very cool. So American Family Care, how, so when you were doing kind of your due diligence and deciding you kind of want to go into business for yourself, what was it about American Family Care that was intriguing to you?
So getting into hospitality, I realized that I really enjoy human connection and I really enjoy helping people and being in some way making their life better or even just their day better. And so I wanted to stay in the hospitality sense or even the healthcare sense, just given that there's that constant flow of people, constant opportunity to make a difference. And American Family Care, I offer that franchise, platform, so that way you could deliver incredible care and run through a effective business model at the same time. And so being able to have all those attributes together in one business, still being able to take care of the community, while also having, a good platform that was pretty, looked like a good opportunity in my eyes. And I mean, I'm young, I'm learning a lot. I have a great mentor. That was one of the first things I did was just, close my mouth and open my ears, just listen as much as possible and just understand that there's a lot to learn. But at the same time, if you sort of bring that extra level of hospitality with everything that you do, and just show that you really do care, it goes a long way.
Yeah, talk about that integration from like your hospitality training and how you apply that to medical now. I think a lot of people get disenfranchised or dissatisfied with their medical providers because it feels sterile. It doesn't feel like a healing experience in a lot of cases. So how have you kind of put your own spin on hospitality and integrating that with a medical office?
Yeah. So, in no way does going to the doctor need to be a uncomfortable situation. It really should be a way that you are made better, and that's not just physically better. That's mentally better. That's being heard. That's letting your emotions be in check. Like anything whatsoever that you come with, we want to meet everyone as an individual and show that we actually do care and offer that extra bit of attention that has seemingly gotten lost in data crunching and making sure that time from door to door is effective, 45 minutes or under. It's like, no, if that patient needs longer time, we're going to give it to them. And it's really just so easy. Like if you look at it from a hotel standpoint to a hospital standpoint or just, medical office, when you walk in, you want to be greeted immediately. You want to be given, the best care from start to finish. Say, hi, hello, how are you doing? Get the name, make it an interaction, not just a transaction. Then you give them their card and you trust like, hey, we're going to take such great care of you while you're here. If there's anything that we can do, let us know, water right there. Sort of give it like a resort feel, like you're checking in, you're about to be on vacation, but instead you're about to, go into one of our rooms for, 45 minutes to an hour and, be taken care of. And so just sort of that same dynamic of, let's make it less medical. Let's make it more personal. Let's make it more hospitable and actually, give everyone that experience that they unfortunately it's not really available as much anymore. Just given the volume, the stress of the staff, just everything in general, that sort of extra level of care and that thoughtfulness in healthcare just needs to be brought back.
Nice.
So,
How are you seeing the community resonate with that approach?
well, fortunately, I will say that the staff they work really hard to get reviews, and so the public on Google we've reached over 200 5-star reviews now.
Wow.
Been open less than a year. So hopefully what we're doing is resonating well with the public, but we're just going to keep doing that. Just keep everyone that comes in, give them, from start to finish, top level care. And even if you have to wait a little bit longer, just know that you're going to receive that same level of care when it's your turn too.
Yeah.
So
Yeah, there are few businesses that are more important to a neighborhood or to a community than having a great place to go get health care. Talk a little bit about the importance of like your medical office as it relates to where you're at in South College, right across from the university, you said, right? In being able to give that zip code or that neighborhood quality health care that doesn't feel like a hospital. It feels more hospitality. That's funny how closely linked those two words are
yeah,
right there, but two totally different things that come to mind when you think about it.
exactly. And we're trying to bring those 2 points together. So basically, I mean, tons of students, most of them coming here, their primary care provider is, elsewhere.
Hmm.
They don't have any medical care here. And a lot of times if it comes up something, or I'm just thinking myself as a student, I, cut my foot on an oyster, that sort of thing. Like your immediate thought is hospital,
Hmm.
but also your thought is, ooh, that's expensive. What else do I do? And so we're sort of that middle ground where we're not so expensive, but we do give you that same level of effective care and we are accessible. I mean, we're right in the middle of town. We're less than 10 minutes from downtown, 10, 15 minutes from the beach, right across the street from the university, 10 minutes from Monkey Junction, 15, 20 minutes from Carolina Beach. It's like pretty much if you show up somewhere and they tell you it's an hour wait, you can drive and come see us and be seen faster than if you were to wait somewhere else for, an hour, just given that we're able to see patients that much sooner. But the students, we just want to let them know that they have a, sense of home here away, at school. And also I was a Seahawk myself. I went through that university and I know how difficult it is going through there on having some health issues and just having a place where you can go to and not have to worry about that.
Right.
Now I'm able to offer that same, convenience to students that I was fortunate enough to have sometimes myself.
So tell us a little bit about your role as the owner. You're not the provider, correct?
No.
Yeah.
So I don't touch anybody.
Okay.
But so my role is I act as the general manager of the site. So I do all of the staffing, all the recruiting, handle all the marketing, handle the inventory, and then any billing issues whatsoever, you'll be speaking with me. I handle or make sure that my third party billing team that they handle everything properly. Any credits that need to be due back, we return to the patient. And I essentially, from start to finish, just make sure that everything door to door operations, go well. But in terms of the hands-on side, the actual providers, we have a phenomenal staff, have an ER physician, have doctor nurse practice, family nurse practitioner, some PAs. They have phenomenal experience, several decades under their belt together. So have a really awesome team. And I actually, going more into the UNCW side, we just started a partnership with the nurse practitioner program at UNC Wilmington. So I have a student coming in doing clinical hours with that. And I actually have UNCW students employed as medical assistants as well in the back.
Nice.
So it's just sort of a way that I could, stay connected with the university, give back, and then, keep that student connection alive. Because, I mean, honestly, I would say that I've, graduated, but I haven't made it very far from college. If anything, I've just gone across the street.
Yeah,
So,
yeah, good point. Yeah, and that's, UNCW has one of the best nursing programs in the state, if not the country. In tying together people coming here and wanting to stay here. We do have a shortage of healthcare providers within the greater Wilmington area. Look at all the Cape Fear region, and it's going to continue to the gap is going to get greater and greater with how many people we have moving here. We can't put people through training programs fast enough to keep up with our population growth. So is that just one of the ways that you're giving back to the community by opening up your doors and saying, hey, come work here, come learn here, and then put them out into the workforce?
yeah, honestly, I wish I had a larger facility so I could house more students. But I know that clinical hours are so difficult to get. I mean, students are willing to go, across the country just to have that, get those hours in. So to be able to offer students a place to come, just directly across the street and then finish out their degree right there. I mean, it's cool to be able to offer that program. But in terms of getting involved with the community, we are trying to expand more. I know that with a couple different schools, we had talked about them sending all their students to come get physicals from us, and then we'll take a percentage of those physicals and then donate it back to the school at the end of the semester. Just sort of a way to stay more involved with the community. But honestly, just trying to do as much as we can with the university, first and foremost, just given being an alumni, and then also they're being right across the street. It's like, okay, if we can do everything that we can do with them, then we can start expanding and, grow with the rest of the community as well.
Yeah. What are some of those other areas that you want your ID or you're looking at expanding into, just in terms of like how you as a person and your business gives back to Wilmington, and some of the needs of our population? Are there other things that you guys do outside of the day-to-day operation of what it is that y'all do, which is wildly important, but just in terms of community service or things along those lines? Are there other programs that y'all are involved in?
So we were talking with Habitat for Humanity about trying to do a build, get something set up with them soon. In addition, there have been several like chamber events that we've been involved with to try and help with the community with that. And then in addition, I know that we were looking at connecting with some different, how would I say it, retirement home groups like the Elder House. And so that way we can offer just sort of an additional like way to offer medicine, but maybe let them get outside of the house, off campus, have more partnerships. But essentially, another way we want to get involved with the community is get partnered with a lot of different employers in the area, larger employers, and just let them know that there is another place in town where all of their employees can come and receive medical care. But at the end of the day, we know that we're offering a little bit more hospitality. We know that we care more than the average place. And so really anyone in the community that needs any sort of help, we'd like to think that we can, be that source of alleviation or some comfort for them.
Love it. Love it. If people want to get in touch with you, they want to come either work for you, work with you, receive medical care from you and your team there. Well, not you, but your team there. What's the best way for them to find out more about you?
Yeah, so the best way, either just go on our website, afcurgentcare.com/Wilmington. There's everything that you would need to know about our site and everything from there, reviews, information about how to get involved. But if you're really passionate and involved and want to get started with us, just walk in the door. I mean, we are a walk-in clinic to begin with. So if you walk in and, show initiative or, some interest in wanting to get a part of it, I'm decent with names and faces. So I promise you will stand out in the crowd much more than a resume that might come through on the email. So
You guys are definitely crushing it in the review game. 224 reviews, 4.9 star. I mean, that's difficult in and of itself to do with a business that hasn't even been open a year. So creating patients that are turning into fans, man. So whatever it is that y'all are doing seems to be working.
Well, I mean, just given that we also offer primary care to all of our patients as well. I know that that is a huge disconnect lately with all the people moving in and the medical infrastructure just not quite growing with it. But it just amazes me how few people are just aware that we're open, we're here, and that there is a place for primary care available in town if other places are full.
Love it. Love it. That's Maxton Sockwell. That's kind of hard to say when you squish it all together.
Yeah,
Max
yeah.
Sockwell would be a little bit easier. It's the ton that gets you at the end.
Well, typically people leave out the last name, but honestly, the only person that calls me Max is my mom. So
Really?
if you catch me at the wrong time, I might turn around and say, "What is
What
it,
is
Mom?"
it? What is
But,
it? Yeah, my mom is
yeah.
the only one who calls me Robert. Everybody else calls me Rob. If I hear Robert, I feel like I'm in trouble. So, Maxton Sockwell from American Family Care. That's afcurgentcare.com/Wilmington. If you want to get in touch with them, thank you for coming on the Connect Cape Fear podcast.
Yeah, thank you, Rob, for having me.
We'll be paying attention and wishing you nothing but the best, man. So that's going to do it for this episode of the Connect Cape Fear podcast. Please don't forget to like and subscribe and turn on notifications. And we are looking forward to talking to you and other local Wilmington business leaders on the next episode. See you then.
Thank you.